Hello, Dr. Drimmer. And for the audience that's listening, I would like to introduce the founder and developer of the cutting-edge concept of advanced ultimate medicine. Dr. Drimmer, what is and why come up with a new concept of medicine?
Medicine as it is doing miracles in the field of emergency. Nobody does better than them. Once we moved away from emergency medicine, then we get into trouble. Because then we're actually managing sickness, nothing else, just managing sickness. And then people getting sicker and sicker, and then you treat them more and more and more, but they stay in the circle of sickness. Rarely they're getting out of that circle. At that point, I decided that I'm doing the same thing, and it's enough. So I thought about it and thought how we can advance medicine as it is for humanity. And that's actually when I took that concept and developed it to what we're doing today. So what is advanced ultimate medicine? There's an excellent say that if you have a hammer in your hand and that's the only tool you have, everybody that will step into your office will look like a nail. So because you have only one tool. So if that's the case, I want to have many tools. When somebody comes into my office, I want to know exactly what causes what he has and how to treat it, if it's in my scope, and if it's not in my scope, what I do with that. So an ultimate medicine or ultimate advanced medicine doctor will have to be really touching many subjects and from many fields to become an ultimate doctor. Just to be a medical doctor is not enough. It's only one tool. It's good understanding, but then in the end you do one thing. You give either pill or you're doing surgery, but that's not enough. If you're only a chiropractor, it's great, but everybody will come to you will be dealing only with subluxations. So that's not enough. If you're a dietitian, biochemistry, you'll deal only with food. That's not enough. If you're a psychologist, psychiatrist, you'll deal only with the soul or what's with it, what goes with it. That's not enough. And if you are an energy worker or energy doctor, everybody will come, you'll just do the energy work. But if you take all 5 of these and you put them into one doctor, then you really make him an ultimate health provider. So that's what was the reason that I took that and put it into one concept. So if you take the 5 types of understandings and you put it into one, then you really create the real advanced doctor. That's the idea.
So what you're saying is you actually take care of the whole person, the whole body, the whole mind. Every part of the person, you're not just hitting one.
So first thing, when you become an ultimate advanced doctor, you need to understand a variety of fields that a human being is constructed from. It's not enough to just prescribe. It's not enough just to move a vertebra. It's not enough just to change diet. It's not enough just to do an energy work. It's not enough just to talk to the person. You really need to see where he's coming from to his illness, to his lack, and to understand it and to know how to direct exactly what he needs and how to work with them globally and bring him to his best through that. So if you don't understand enough psychology, if you don't understand enough biochemistry or how to provide the correct foods, correct drinks, and if you don't understand enough allopathic medicine or chiropractic medicine or energetic medicine, what are you going to do? You're going to concentrate on what you know, and that's going to be it. But it will be missing a lot, and that person will fall between the chairs, as we say. That's the idea. So when you are...
Absolutely amazing.
Thank you. So when you are an ultimate doctor, advanced doctor, and you learn these fields, and you know how to pinpoint what that person needs, either from one area or from 3 or 4 areas, then you can really direct him, treat him, and take him out of the sickness circle into the health and wealth circles, then you're really doing your job as a doctor.
It's an amazing concept. People now are going from doctor to doctor, running around trying to get answers from so many different doctors. And this is a one to come to one place and to be actually understood from all facets.
On average, patients that's coming to us, they are seeing between 6 to 10 different types of doctors and other health providers before they come to us.
And they're not in communication with each other, so they're not actually able to treat responsibly because everybody's coming from different angles.
They're not in sync.
They're not in sync.
And the patient is losing patience. He's not patient anymore. And when they come in here, they're frustrated. And then the question is, which we see time after time after time, I can't believe it. How they didn't know that.
But there are holes.
Exactly. So when you go and treat people, you really want to be very knowledgeable and be a whole doctor. I don't like the word holistic doctor, but advanced doctor, because you need to see from all angles the patient itself. And a human being is very, very, very complicated creature, great creature. So you need to get to the understanding of what brings him to his illness, to his sickness, and to help him get out of it on its own.
Can you tell everybody listening a little bit more about the 5 pillars and make them a little bit more clear for me?
So the 5 pillars of advanced ultimate medicine are, the first one is biomechanical, and it will include the chiropractic, osteopathic, physiotherapeutic type of treatments. The second one is psychological. The third one is biochemistry, biochemical, what we eat, what we drink, what pills we take, what vitamins, what minerals we should take. The next one is allopathic medicine, is conventional medicine. We need to understand it very well. And the last one is energetic medicine. These are the 5 pillars that actually make a whole doctor out of these. Then you can give real answers, and when you're sitting in such a clinic and people coming with complications of things, you know how to bring it together and give them the best they need.
And actually heal.
Getting out of the circle of illness into the circle of wellness. Because usually they're staying in the circle of illness, just being managed in there. Lately I saw very interesting interviews with psychiatrists. And the interviewer asked psychiatrist after one another, how many patients did you heal? All of them, one by one, said they never healed anybody. And they couldn't even find the word that said what they're doing. So they just say, we treat him. He said, okay, and then what happened? They said, we just treat him. In regular medicine, in other type of medicine, you just treat. But what happened with that? Yes, you want to treat. Yes, you want to manage them. And then yes, you want to take him out of that circle into the new one. From sickness circle to the wealth health circle. Then they're really happy. And if you can't, you still manage them there, but in their best. You're not leaving them in the same type of circle, and they're going down in the circle, down, because they're getting worse and worse and worse. You just manage them, it's not enough. You need to bring them up and up and up and up. That's very important.
Thank you very much. Let's go a little bit, if it's possible. Can you tell me a little bit about each pillar of your concept?
Absolutely.
The first one is biomechanical. What do you mean by biomechanical?
The spine is the backbone of our being. Everything goes through the spine. The spinal cord is a continuation of our brain. Every order goes back and forth between the brain, the spinal cord, and the rest of our body through the nervous system. If the nervous system is compromised because of vertebral problem, because of any type of tissues that surround the joints, and the vertebrae, then the information will not pass as it should pass between the brain, the spinal cord, and the body, and back to the brain. So if you take a spinal cord and you have a problem within the spinal cord, you can pour in here as much water or medications as you want, and you can do as much energetic work you want, but if that would be blocked and not letting that flow through correctly, it doesn't matter what you're going to do, it's not going to be enough. You can have any pills you want, you can change any diet, but this doesn't go through correctly. So the biomechanical is very important when you remove an obstruction and you allow that to do its work, and then everything works. So that's the aspect of the biomechanical. Every part in our body, every system in our body is working on orders and information that being changed between the brain, the spinal cord, and the body. So any compromise there that you're not going to give attention is not going to help you. So if you don't understand it very well, and you don't know how to correct it very well, people will come to you. You can give them anything you want. You can talk to them as much as you want. You can feed him whatever you want to feed him. You can try to work with him energetic as much as you want. But if you're not removing this interference, it's not going to help you. So you need to know that. You need to understand it. You need to recognize it, and you need to give it solution, and then move to your next type of pillar so you can help them from there if needed. Maybe that will be the only thing they needed. But if
makes so much sense.
It does. Because if you don't understand that, it doesn't matter what you're going to do. You can change the diet as many times as you want, but that might not be their problem. But maybe a blockage in their C1 vertebra that create tension on the spinal cord that goes through the skull into the spinal cord, to the spine. So this is very, very important type of medicine that without understanding it very well, it's very difficult to help your patients.
Okay, so that was the biomechanical. Now let's go to the second pillar that you called psychological.
Very important pillar. So we are body and spirit. We are body and soul. If somebody wants to object it, he's welcome to. So they'll squeeze his air out and see if he continue living. So I'm just joking a little bit, but so the soul is very important. If you don't give it a correct intention, if you don't understand from where the patient comes to his illness or sickness or his discomfort or to his dis-ease, it's very difficult to correct him. So if you have pain in your tush and we fix it for you and you go back and sit on the same nail all the time, you're going to repeat your problem. So if your problem coming from your emotional background, from a mental problem that you have with something in your work at home, if you don't deal with it correctly, it's not going to help a lot when you try to fix somebody's blood pressure, because his blood pressure will skyrocket because he's very tense, and if you're going to give him the pill but you're not going to help him emotionally or mentally, it's not going to help him. So it's very important to semi-analyze him, what we call here immediate psychology, between 1 visit to 3 visits, to recognize the weaknesses and strengths in their spirits, in their soul, and from their psychological evaluation, give it an answer very quickly, give them the tools to understand that, and move them from that mental capacity to the next one. Then you really can give them a comfortable edge to become healthy if one of the things that brings them to sickness is their mental health.
So what you're saying is they can come in with problems, but if there's a blockage psychologically, you're never going to be able to really rid them of that issue or heal that issue.
Exactly. So a lot of them coming with, let's say, IBS, that where they have irritable bowel syndrome, for example. And it's not their food. It will be the mental state, because they were hurt and because they're holding something and because they're not sure about something. And they interpret that through their gut. And everybody's going to treat their gut. And that's not the problem. The main cause will be what is their mental state will be.
What was their trigger?
Exactly. So then when you deal with that and they recognize that and they understand that they can heal themselves, you help them to do that, and then the IBS goes away. So you need to be really keen and accurate about finding the cause for that person, and within a session to 3 sessions that you talk to him and recognize what is causing what, then you can help him a lot. So that will be the second pillar that will be combined with the rest of them. Without it, it's not complete.
Okay, let's go on to the third pillar. The third pillar is the biochemical pillar.
Yes. So biochemical will cover the area of what we eat. We cover the area of what we drink. We cover the area of what we'll be exposed to. If you're smoking, if you're drinking wine, if you're exposed to electricity. If are you on pills, any type of pills. If this is a very important issue. Our food is our fuel. And if our fuel is not very correct, our machine, our biochemical machine, will not be able to process that fuels correctly and will start to develop problems. First problem we'll develop will be to be in acidic mode, and then we're going to be in infectional mode. Will be in a type of digesting or putting a lot of effort to digestion where it's not complete. So we're going to develop a lot of problems or basis for the wrong bacteria, to the wrong viruses, the wrong fungi. And that will lead to a lot of problems. You can have a lot of headaches, and everybody will examine your head or your first vertebra, and it will appear to be that you're allergic to some type of food. So you need to analyze it very well, understand it very well, and then give answers through the biochemical fuel that you're putting into your body and to what you're being exposed, to be able to help that person be very accurate about what he eats, through understanding his blood tests, through understanding his microbiome, by understanding the time that he eats, and to combine it all together and give him a really, really very accurate biochemical profile that is accurate for him. And then that would be at least 20% of his health, because we have 5 pillars, it's 20%. It will be very accurate for him to get out of one cycle and to go back to the next cycle. So the headache, for example, or the heart problem, or the kidney failure, or diabetes, or psychological problems can come from biochemicals, from what you eat, what you drink. And if you don't know how to combine it into the system, you're going back again to do only one thing that will be only 20% or less what needs to be done with that person to take him out of the cycle of sickness into the cycle of health.
Okay, but that's pretty important, huh?
Very important.
Let's say the basis of everything. I've been starting to really understand it. Let's go next to the number 4 pillar, the 4th pillar of your concept, which is conventional or allopathic medicine. How does that come into this picture for you?
Conventional medicine, allopathic medicine is very, very important medicine. It's the chief medicine in emergency medicine. They are the best pillar in everything that is within emergency medicine. This medicine puts so much money into research in many areas of human health. So yeah, they have a lot of research, they have a lot of understanding on pathology, they have a lot of understanding on processes, they have a lot of understanding treating chemically the body or surgically the body. So without understanding that, you cannot be a complete doctor. You need to understand it very well. You need to understand when to prescribe medications. You need to understand when to prescribe surgery. You need to know when to prescribe rehabilitation. So through understanding that, you can be very precise when a patient comes to you and you don't miss out on something that he really needs. For example, a child came to me with his parents. He was in an asthmatic, very severe asthmatic. The parents came to me and they say, listen, we know that you are the only one can heal our son. And I said, guys, this kid is going now to emergency room, being handled in emergency room, getting out of the emergency with medical doctors. And then for further treatment, to take him off all the medications that he's right on, up to that point that didn't help him, then we'll continue working with them from all the rest of the pillars. But the first thing you need to do is go now to the hospital, save his life, then you can come back to us. And there was, no, we want you to treat him, you can take him out. I said, no guys, he's going straight to the hospital. So we need to recognize when to use which type of medicine as a whole medicine. You have to. And allopathic medicine is very important medicine. Very important. The lifesavers, the angels, they're doing holy work. So need to know that subject very, very well.
Okay, and the last pillar, which is known to you as QMM, quantum mind medicine.
Right. So quantum mind medicine, we're talking about, as a whole, we're talking about energetic type of medicine. So we are creatures of energy. 99% of our body is energy and information. 1% of our body is appeared material, only appeared material. It's very confusing for most people. They think that they're made out of material mostly, but we are made out of energies mostly and information, and then we appear as material to experience this world, to go through this world with the machinery that we call a body, to experience that, to do what we want to do in this time of lifetime that we're going through. So the energetic part is very, very important. A lot of people like that, a lot of people want that, and it's not very easy to deal with because it's the unknown, the unseen. However, due to the fact that we are energetic beings, if you not give that very precise type of understanding and work, you can do a lot of things to the person. And if he's not aligned with his Reder or with his energetic, human energetic cosmic energy.
I'm sorry, let me stop you for just a second.
Yes.
What exactly is Reder?
Reder is everything everything on the earth, everything in the cosmos is in vibrational frequency. Everything. Nothing is at rest unless it lost his life or his capacity. So our bodies are in constant Reder, which means a vibrational frequency. Each one of us has his own vibrational frequency, like you have your fingerprint, like you have your cornea print, right? Everybody has its own. So Reder means your vibrational or your energetic cosmic human signature, or your human vibrational cosmic signature.
Which comes from where?
Comes from outside of us, from the quantum field. We are beings that are being run from the outside inside. So if that not in sync, if that not in the correct Reder, which is a combined word in Hebrew between vibration and frequency, that means Reder, Retet v'Teder, then you are not a complete person, or you are a lacking person. Because that force, if it's not in line with you, if it's not being emphasized, and if you not create that force in you again and again and again, you're not coming to your potential anymore as a human being. You are in sub-potential all the time. As less you connected to your Reder, to your human energetic cosmic signature, only yours by the way, nobody can perceive yours, nobody can get it into his body through our brains, only you. But if that energetic cosmic human signature is not in sync, you're lacking, you're sick, you are poor, and you're not having fun in this world. So this work is so very important.
I'm still a little bit unclear.
Yeah.
Can you explain to me a little bit in more detail on what you do in order to keep that energy coming through you?
What we have two types of energy. One energy is coming from the outside into our body. One energy we having a force coming from outside to our body is its informational energetic light force comes into our body. And that actually creates us. And in our brain, it's being converted from cosmic energy to biological energy. The biological energy runs our systems and keeps us alive 24/7. The cosmic force is, people can call it soul, people can call it whatever they want to call it. But the cosmic force is in existence all the time. When you receive it, when your body is decaying or dies, then that force is not running you anymore, okay? Excuse me. So if that force is not, you're not in your full potential of that force, you're actually lagging in this life. So you want to be in full potential. Quantum Mind Medicine helps you come to your full potential with this force through the biological energy, to the cosmic energy, through the cosmic energy to your biological energy. That's Quantum Mind Medicine. That's what it does.
When a patient comes into your office and you sit with the patient, is what you're saying, you really have to be a master of all of these 5 pillars. And most of the time, you deal with all 5 of them for every patient.
Yes.
It's not really one for a problem. You have to look at everything in order to really have a grasp on that soul, on that person.
Exactly. Every patient that comes to us fill up a lot of forms. And the forms are conveying all these 5. We see what are the pathologicals here. We see what you eat. We see how you think. We see how your relations. We see how your sex life is. We see if you have injuries. We check if you have surgeries. We check you all the way around. And then we can see where's the emphasis coming from. And then we question you and we talk to you to see really what's going on behind the scenes. And then slowly we can build a picture to see where we are directing you, through what pillars we're directing you. Sometimes it will be through 1 or 2. Sometimes it will be through all 5. So we are becoming more and more accurate in that. And you can, most of the time, not all the time, most of the time, can give very correct answers to the patient that comes to you because you cover all the areas. Most of them come to us and say, wow, so many forms I need to fill. Why? And we tell them, because we want to see all the areas of your life that brings you to illness, to pain, to fear, to lack. So if you're not really fully understanding these 5 pillars, at least the 5 pillars, I'm not saying there are no more pillars, but these are the main ones that we choose to create this ultimate advanced medicine. And they have subtitles, but it doesn't matter. Right now, if you understand that and a patient sits in front of you, she or he feels that you understand what is the real cause of their illness, sickness, fear, or pain.
Amazing. The patients actually come in and finally feel understood on all levels.
Time after time, time after time. I hear that this is the first place in many places I've been that they're looking at the whole picture. We're looking in x-rays, we're looking in MRI, we're looking blood tests, we're looking in bone scans, we're looking at psychological evaluations, we're looking at the pills they're taking, we're looking at the food they eat, we're looking at what they drink, when they're going to sleep. You're looking at all things. How's the relationship with the parents, how's the relationship with the spouse? You build it up, you understand it, then you can give them, because in health, things are not as direct as they look. A lot of things are hiding, but they show something else, and everybody's going to the obvious. It's not enough. You need to go and see the whole picture and then give the right answers through the whole picture. Most of the time we can do that, not all the time. because the human beings are very elusive in what they're portraying, what they're showing. So you need to cover more and more, you need to understand more in order to cover more and more what brings them to the illness, to the fear, to the pain, to the capabilities, to the potential, and I like it.
Dr. Dimmer, I have another question that I think is very important. How long have you been practicing medicine with this concept, first? And how have your outcomes been with the patients? Can you tell me a little bit about outcomes?
Yes. So I'm practicing this concept for a long time, but I never gathered that into one. I did part of that and part of that and part of that, understanding from here. Slowly I started understanding that I need a whole concept. So then I built it up within, it took me like about 3 years to build it, to come to the understanding that it's going to become from 5 pillars to one advanced ultimate doctor. So once I start incorporate that as one on each patient, the outcome were great. So we have people filling up questionnaires before, filling up questionnaires after, and the results are very good. We are measuring them, we're putting them into empirical tests, and we will come up with research on that. Beyond that, we are interviewing people. So we have like 85 people that we interview that are on tape, that are very happy with the results. We have a lot of people that acknowledge that it's something very different from anywhere that's been before. So we are working on the results to see how to accumulate them and bring them out, because we are happy with the results. We want to make them even better.
Amazing. I guess the last question that I have for you is, where do you see this going? Now that you've developed this concept, this 5-pillar system, where would you like to see this go? What's your vision?
This vision, my vision is that the next med school will be an ultimate advanced medicine school, where students will not learn only chiropractic. Students will not learn only allopathic medicine. Students will not learn only to be dietitians or acupuncturists. Or I want to create the first university in the world that brings in the ultimate medical doctor, the ultimate health provider doctor. And that's the direction we're taking now. We're checking the world now to see how the academia will take it and where to integrate such a university that will provide the next ultimate health provider in the world. That's the vision right now. So we're working on it. We are open to suggestions, and we are waiting for this step to happen. We are working on it, and it will happen.
Thank you. Unbelievable. Thank you so much for your time, so much for your work, so much for your energy and your efforts, Dr. Dimmer. We appreciate it.
Thank you.